I'm just pulling up the order. Mr. Speaker, I move that I'm just pulling up the motion. Sorry, Mr. Speaker. Mr. Speaker, I would like to move that consideration be given to the draft order entitled the Public Health COVID-19 Emergency Extension Number 3 Order 2021, proposed to be made by the Minister of Health in exercise of the power conferred pursuant to Section 107A of the Public Health Act 1949.
Members, are there any objections? There are none. Continue, Minister.
Thank you, Mr. Chair. Mr. Speaker, thank you. I am pleased to invite this honorable chamber to consider the order entitled Public Health COVID-19 Emergency Extension Number 3 Order 2021. Mr. Speaker, members will be aware that the current public health emergency order is scheduled to lapse on the 24th of June 2021. The emergency order, in place since the 30th of June 2020, following the state of emergency in place from the 1st of April 2020, is made pursuant to Section 107A of the Public Health Act 1949 and declares that a public health emergency exists in Bermuda due to a communicable disease that poses a threat to the island. Mr. Speaker, we live on a very small island, and as we all know from outbreaks in December and as recently as March and April, COVID-19 can spread quickly and impact our whole community as hundreds of persons test positive and thousands of persons end up in quarantine. Mr. Speaker, we can slow the spread of the virus by following basic public health advice of wearing a mask to cover our nose and mouth, as well as physically distancing, downloading the We Health Bermuda app, and avoiding the 3 C's of closed spaces, crowded places, and close contact settings. The more barriers and space there is between you and others, the harder it is for the virus to spread. And also, Mr. Speaker, we in our community are fortunate in that we have added another layer of protection, namely the COVID-19 vaccine. Mr. Speaker, as has been said many times, vaccines save lives, and it is no different with the Pfizer, BioNTech, and the AstraZeneca vaccines being used in Bermuda right now. Both vaccines have proven to be highly effective after 2 doses. If immunized and you do get COVID-19, you are likely to experience more mild symptoms and become less ill as your body is better able to fight off the virus. This means we can keep people out of the hospital and have fewer deaths due to COVID-19. With a reduced viral load in your system, it is also hoped that you are less likely to transmit the coronavirus as well. While researchers continues to delve into the impacts of vaccines on transmission, the initial studies are very promising. Mr. Speaker, this government is firmly of the view that the COVID-19 vaccine is the key to our return to normal. Mr. Speaker, Bermuda's goal of community immunity will be achieved when 70% of the population has been immunized. To date, 64% of the population has been vaccinated with 1 dose, and 55.4% of the population has been immunized with 2 doses. But when you take that into consideration, just the eligible Bermuda population, and those namely, Mr. Speaker, from the age of 12 above, 72.2% of that population has been vaccinated, and 62.5% of that population has been fully immunized. And these are great results so far, Mr. Speaker. And I have to extend again a thank you to all the people who have taken the step to get their vaccination to protect themselves, their families, and our community. Mr. Speaker, as a government, we recognize it will take more time to reach that goal of community immunity. Therefore, a more immediate goal is the immunization of 90% of persons over 65 years of old, which is our most vulnerable group. And I'm very pleased to report, Mr. Speaker, that while 6% of residents over 65 years old are vaccinated now with 1 dose, an impressive 76% are fully immunized with 2 doses, which means we are well on our way to achieving our goal of at least 82% will be immunized. And again, that's of that age group of over 65-year-olds, which are our most vulnerable. To repeat, Mr. Speaker, preventing infection, the onset of the disease itself, and community spread via a program of mass vaccination will be a critical part of how we navigate our way out of this pandemic. We have all felt the impact that COVID-19 has had on us personally, and we all know how it has impacted our island's economy. Getting vaccinated is an integral part of our ongoing collective effort to reduce the spread of the virus here on the island. This is essential not only for our health, but also to allow us to return to a sense of normalcy within our lives. And if you have not had the vaccination, we please invite you to speak to your doctor or a trusted medical professional to help you to make an informed decision. Mr. Speaker, honorable members, as we all know, COVID-19 was caused by a new virus that spread quickly throughout the world. Unfortunately, it still exists in large parts because it can be transmitted so easily between people who are in close contact or through coughs and sneezes. While most infected people suffer mild flu-like symptoms, some become seriously ill and some even die. Mr. Speaker, in my role as the Minister of Health, I consulted with the Chief Medical Officer and determined that a communicable disease of the first or second category, namely COVID-19, continues to pose a severe threat to public health in Bermuda. The recent outbreak, which saw both a sharp rise in positive cases and an increase in deaths, highlighted the impact of variants of concern, in this case, the UK variant of COVID-19, the B.1.1.7. To control and contain the spread of infection, public health measures such as those provided for in regulations will continue to be relevant and necessary beyond the 24th of June, 2021. This order, Mr. Speaker, before us now will extend the Public Health COVID-19 Emergency Order 2021 made under the Public Health Act 1949 to permit the governor to continue the Public Health COVID-19 Emergency Powers Regulations 2021, which impose extraordinary measures necessary in the interest of public health to prevent, control, and suppress COVID-19. Mr. Speaker, honorable members will be aware that the Public Health COVID-19 Emergency Extension Order Number 2, 2021, was made under the positive resolution procedure effective the 25th of April, 2021, for 60 days due to expire on the 24th of June, 2021. However, the COVID-19 pandemic continues to rage globally and a public health emergency continues to exist on our shores. Therefore, in accordance with Section 107A3 of the Public Health 1949, I bring the Emergency Extension Number 3 order to this honorable chamber to prolong the state of public health emergency for a further 60 days ending on the 23rd of August, 2021. Thank you, Mr. Speaker.
Thank you, Minister. Does any other member wish to make a contribution at this time?
Thank you, Mr. Speaker. MP PEARMAN.
MP PEARMAN, you have the floor.
Thank you, Mr. Speaker, and thank you to the honorable and learned minister. Mr. Speaker, the opposition is not here to be critical for criticism's sake. And what I've always tried to do when I've spoken in this honorable house is to point out things I believe the government is doing well, and to point out sometimes things that I believe the government could do better. Let me start with this. The news from the Honorable Minister of Health that there are those 64% of our island who have had at least one dose of the vaccine is heartening news. The goal is to get to herd immunity. And as a matter of logic, those people who've had at least one dose are likely to have a second. And 64%, it may not be the number the government was hoping to be at for May was their target. But nonetheless, again, credit where credit's due, it's a good number for those trying to get to herd immunity, which we should all be trying to do, whether or not we wish to have the vaccine. Because if the island can achieve herd immunity, everyone will be safer, whether they are immunized or not immunized. Likewise, let me also commend the minister for the point about the over 65s, the most vulnerable. The statistics and numbers that she just presented to this honorable house are indeed heartening and very good news indeed. I also think that it's commendable that this jurisdiction, that this country, this island has taken as important the respect for personal choice, and the fact that whether or not someone chooses to be immunized is a matter between that person and their doctor, or indeed a matter between that person and their family, or indeed a right of the particular person as an individual, if he or she so chooses. And so those are the positives here. But what is this order actually doing? This order is extending emergency powers for another 2 months. Mr. Speaker, many, many months ago, when we stood up to consider emergency powers being wielded under the Constitution before they were moved to the Public Health Act, there was some concerns expressed as to the length of time for which emergency powers are extended. Because as a matter of liberty and fundamental principle, emergency powers should always be no broader than is absolutely necessary. Why do I say that? Because it is an infringement on personal liberty. It is the state telling the citizen what he or she is allowed to do. And sometimes, Mr. Speaker, that's necessary. And that is the language of this particular act, necessary. But it should be no wider than is absolutely necessary. And so, in respect of this extension of time, which seeks a further 2 months for emergency powers, our position, and it's offered respectfully, is that you have to look at the community that we serve. For 18 months, I may have the number of months wrong now, but it's been a long time, Bermudians have labored collectively under significant, fundamental, and draconian restrictions. And all of us are feeling beaten down and frustrated and fed up. Those of us who follow the rules because we know we are trying to help our fellow man and woman on this island. But when we look and we see a position today where there are very few COVID cases, where we are, as I said earlier today, on a downslope, hopefully, we all hope, and perhaps we're walking on the valley below as well, I don't know. And in those circumstances, Mr. Speaker, we wonder whether 2 months is too long. Now, we are supporting the extension. We would support a month. But I think this government needs to take the pulse of the community. And the pulse of the community, in my view, respectfully, is that they should be no broader and wider than need to be. So Parliament's sitting. We can come back here any Friday. We can pass a new extension order very easily. And ultimately, we're here to serve the people. And there's a palpable sense that the people aren't being listened to on this issue. And so it is our respectful suggestion that yes, there should be an extension, but that 1 month is perfectly adequate. And it can be extended on a month-to-month basis thereafter, based upon the COVID numbers, based upon the facts, based upon the science, based upon the medicine, but also based upon the toleration level of our community. Because it is not just COVID that is an issue for us, it is also mental health and economic decline. And Mr. Speaker, just in closing, I think we have to look at the impact of these restrictions, because when we're looking at these restrictions, we're dealing with aspects of Constitution. And, it's fine to point to a piece of paper and say how important it is, but why is it important? It's important because it regulates the rights of individuals, the human rights of individuals, and the state, the government. And I am concerned that some of the suggestions are of questionable constitutionality. We are concerned that to restrict Bermudians from returning home is wrong. And we are concerned that a mandatory quarantine of non-immunized persons at their cost is highly likely to be unconstitutional. And so, against those considerations, and there were others in the debate earlier from both sides who raised these concerns, we do invite the government to have a rethink about this. It all seems to be a bit of a scramble. We haven't seen the regulations for Sunday. And we hope the government will listen, will learn, and react in a sensible and positive way. In respect of this particular order, Mr. Speaker, we would certainly agree it be extended. We would suggest it be extended for a month. And then we look at the facts as they are on the ground in a month's time. And we are in session, Parliament is in session. It can very easily be extended if that is what the people wish, and that is what the medical situation calls for. Thank you, Mr. Speaker.
Thank you, Honourable Member. Does any other Honourable Member wish to make a contribution? Any other member? None?
Mr.
Minister?
Speaker, I will happily speak, Mr. Speaker.
Premier?
Yes, Mr. Speaker, thank you very much, Mr. Speaker. I had the understanding that one of my other members was going to speak. So be it. Mr. Speaker, just very briefly on the extension of the public health emergency, because I think that it's very important that we understand the construct of what it is that we are actually doing. So there is no question that there is a public health emergency because there is a global pandemic which is still raging. And we all know this, despite the wonderful statistics and how well we have done, we know that there is still a public health emergency that is required inside of this country and one that is global. Based upon the fact that in last January, the World Health Organization issued a notice of a public health emergency of international concern. That public health emergency of international concern has not ended. We know further, Mr. Speaker, that also after that declaration, clearly they declared a pandemic, and we've been dealing with the coronavirus pandemic since that time. It is important that we understand that the extension of the public health emergency allows the Minister of Health the ability to make sure that rules and regulations are in place to control any possible spread of the coronavirus. Yes, it is the tools that are given to institute items such as curfews. Yes, it is the tools that is given to implement items such as restrictions on freedom of movement. And yes, I would firmly agree with all in this thing that there are items which have to be taken lightly. That is the reason why when we passed this amendment last year, we ensured that it had to come back to the House of Assembly so that it can be democratically voted on as to whether or not these matters should continue. And we will continue to go back to the House of Assembly in that manner. But I think it's important that we separate what a public health emergency is and the regulations which fall under the public health emergency, because they are two different things. Now, what the government stated, as we laid out in April, our strategy for moving the country beyond the pandemic. And it was a combination of strict controls internally to eliminate local transmission, combined with an increase of vaccinations in the country, combined with stronger and stricter protections at the border. Those are the three aspects, Mr. Speaker, that form part of the strategy to move Bermuda beyond the pandemic. When I gave a national address on behalf of the government towards the end of April, I said that we would like for the public health emergency to be able to expire on the 24th of June when it was set to expire, Mr. Speaker. And we all know, we all understand that. But the conditions were that we had reached community protection or that we had eliminated local transmission. We've been relatively good on the local transmission side, Mr. Speaker. But the fact is that we have not yet reached community protection. What is important also to note, Mr. Speaker, is that as of June 20th, by and large, most restrictions in the country are going to be lifted due to the excellent work of all of us as citizenry. And so the items such as capacity restrictions in restaurants, the things of which people don't want to do, wear masks outdoors in the sweltering heat, all of those matters are being relaxed. So I do not want anyone who's listening or to think that a 2-month extension to the public health emergency means a 2-month extension to restrictions or a curfew or other types of matters. It is a recognition that in this country, there is a public health emergency, and the government of the day must have the tools in which to deal with a public health emergency. And I think it's key and critical that we understand that, Mr. Speaker. Because what we don't want to do is that we don't want to get to a place where the minister is just declaring public health emergencies repeatedly. Then that is why we are bringing it this way. And that is the reason why, Mr. Speaker, we're extending it for 2 months, because we extend it for the longest possible period. If we run out a place where we no longer need a public health emergency, no longer need restrictions, it is able to be ended. But it is very likely, Mr. Speaker, that before we rise, we might have to bring another extension to make sure it lasts over the time that the House of Assembly is out on vacation. So these are the things, Mr. Speaker, which are important, but I want everyone to understand what the framework is. The public health emergency and its extension allows the government, allows the Minister of Health to issue regulations that will control the spread of an infectious disease, in this case, the coronavirus. There is no doubt that we're in a public health emergency. There is no doubt that there are dangerous variants. And there is no doubt, Mr. Speaker, that we are still not out of the woods. When I spoke to the country on Tuesday night, Mr. Speaker, I said, the ending of most of the public health restrictions does not mean that the pandemic is behind us. And I think it's important for all of us to know and to remember. Mr. Speaker, I'm human like all of us, and I have feelings like all of us, and I have friends like all of us, and we recognize and we understand how contentious issues have become over government policies. But here's the thing, Mr. Speaker, leadership is extraordinarily difficult. You know that, Mr. Speaker, having been a leader. Members know that, being leaders themselves. And oftentimes, you have to make the best of two bad decisions. What I've learned in this time is that you cannot underestimate this virus. Whether it's the mutations of which we saw, which devastated our country when they came into place in March, and we saw the massive spike in cases, Mr. Speaker, there was a time that Bermuda led the world in coronavirus statistics. The wrong way, not the best way, Mr. Speaker, the wrong way. We had the highest infection rates, highest number of new cases on a per capita basis, hospitalization, all of those things, Mr. Speaker. Our hospital, Mr. Speaker, was almost overflowed 3 days due to a highly infectious variant. And now, Mr. Speaker, the Delta variant is 60 times more infectious than the one that ran through our country. So we all, as citizens, have responsibility. And we, as leaders, have to ask ourselves whether or not we wish to move beyond the pandemic. And so with this extension of public health emergency today, Mr. Speaker, I think that it's important that we recognize that we still do have a public health emergency. And until the public health emergency ends around the world, it is likely that we will still have restrictions here. However, Mr. Speaker, if we are able to get ourselves to community protection, if we're able to creep above, because the more contagious the variants are, the higher level at which we need, if we're able to creep above 70% of the population, or even move higher, then there can be a time when we can end the public health emergency here in the country. And at the same time, make sure that we have strict controls at our borders to prevent the importation of new variants. We've done a good job, Mr. Speaker, and none of it has been easy. No one likes making difficult decisions, but that is what our job is. And so I support the extension of the public health emergency today, Mr. Speaker. I think it is just and valid. We know that we're in a public health emergency, but I am excited to know that with this extension of the public health emergency, for the first time since we entered a state of emergency, which was under the Constitution of the Public Health Act, in April to now, it is the first time that the government will be able to relax social distancing restrictions, to relax a lot of the controls which we have, to allow large groups to the limit to be set at 100, to make sure that restaurants can reopen to full capacity, and other types of things, Mr. Speaker, because we've made progress. So while we are still extending the emergency, it is important to note that the country is in the best spot that it has been since we entered this pandemic in April. And that is due to the hard work of the Minister of Health, the hard work of all the teams at Health, and the hard work of all of the dedicated public officers who are doing all of the work, Mr. Speaker, to make sure that this strategy be executed. We are tired, Mr. Speaker. There is no doubt. We speak to public health officers, public servants all the time that say they want to get back to dealing with policy. And so, though we are extending this public health emergency, Mr. Speaker, it is great to know that we are seeing the light at the end of the tunnel. And the restrictions which will come into place on Saturday, as was mentioned in the Minister of Health on the press conference on Tuesday, will be the least restrictions this country has had since we began the pandemic. There is a little more to go. And in addition to the public officers, Mr. Speaker, I'd like to thank the people of this country who, by and large, have stood by us and have understood the difficult decisions that have to be made in order for us to return to a sense of normality. Pandemics are stressful. They damage public health. They damage mental health. And the only way we repair that is moving beyond them. And that's what this government is set out to do, Mr. Speaker. So I support this extension, and I thank the Minister of Health for her dedicated work over the past 16 months.
Thank you, Mr. Speaker. Does any other member wish to make a contribution at this time? No other member? Minister?
Thank you, Mr. Speaker. I don't intend to prolong the debate. I think that the Honorable Premier summed up the position very, very eloquently. It's unfortunate that we are at this place still, but the reality of the situation is, and one needn't only look at Bermuda as well as internationally, what the statistics are concerning COVID. We still are in the middle of a pandemic, one that none of us have ever lived through. None of us probably would have expected to have seen this. And the reality is that we still have to be able to have the tools to issue regulations to help to control the spread of COVID-19. And with that, Mr. Speaker, I would like to move that the draft order be approved and a suitable message be sent to Her Excellency, the Governor.
Thank you. The message will be sent with the appropriate message contained in it.
Thank you.
Thank
Mr.
you. We now move on to the next item on the order, which is item number 6, the consideration of exchange of land agreement between the Corporation of Hamilton and Hamilton Warehouse